Good morning and good afternoon, everyone. Welcome to the Med Results Network 2017 Educational Webinar Series. I'm Jamie Parrott, Vice President and Chief Operating Officer of Med Results Network, and I just want to thank you all for taking time to join us for today's presentation. Before I introduce our speakers and dive into the webinar today, I want to welcome those of you who are not Med Results Network members, as we have several attendees who are actually joining our webinar for the first time. So thank you all for participating today, and for your benefit and as a refresher for our members, I want to spend a minute describing who we are and what we do at Med Results. Our organization has been around since 2008, and we're the largest aesthetic purchasing organization for all types of aesthetic practices. We currently use the buying power of our nearly 3,000 aesthetic medical providers to negotiate for cost savings like discounts and rebates on behalf of the entire membership. And our members have access to savings from close to 50 vendors on everything including injectables, skincare, capital equipment, patient financing, and of course dozens of services. So for those of you that are not members and you are aesthetic providers, I certainly encourage you to join. There's absolutely no cost to belong, just cost savings and of course tons of education, just like today's presentation. And over the last 7 years that I've been with Med Results, I've discovered that the key to our members' success is really the access to knowledge and education, which is why we place such a heavy emphasis on working with industry experts and our partners to do these educational presentations every other week. So now that I've given a brief introduction of Med Results to our newcomers, I have the privilege of introducing the co-founders of Changewell Training Academy in San Diego. Dr. Mark Tager is well-grounded in the challenges of building a cash-pay healthcare business and in serving companies who provide products and services. He has a deep understanding of aesthetics, having served as the founding marketing director for the fractal laser, which I'm sure all of you are familiar with, and that's where he taught the science of fractional photodermolysis to countless colleagues, and he was also the chief marketing officer for Syneron. Mark co-authored one of the earliest texts in practice management called The Art of Aesthetic Practice with Dr. Stephen Mulholland, and he has always had a passion for lifestyle and personalized medicine. In his early career, he established an integrative healthcare center and served as director of health promotion for Kaiser Permanente in Portland, and he's of course a course director for the Practice Enhancement Training Program for A4M, the Academy of Anti-Aging Medicine. Dr. Tager also regularly consults with cosmeceutical, nutraceutical, and medical device companies. Robert John Hughes, our other esteemed speaker for today, is a marketing strategist, a brand advocate, and media business entrepreneur. And his expertise is so extensive, it includes the fields of marketing, advertising, business consulting, leadership training, public relations, journalism, and broadcasting. He's done a million things, and he's also a former White House news correspondent for a major American broadcaster. Mark and Robert are co-authors of their breakthrough new book, Enhance Your Presence, The Path to Personal Power, Professional Influence, and Business Results. So we are delighted to welcome both of them today. And just a quick reminder, during the presentation, if you have a question or comment for either Mark or Robert, please use the chat feature to connect with them, or we'll send you a quick survey after the presentation today, and you could ask them a question in that way. So with that said, I will turn it over to Mark and Robert.
Thank you so much, Jamie. This is Robert John Hughes. I am the one on the right side of your screen, and Mark and I are sitting in the appropriate order. He's on my left, and to the extreme left you see a copy of our new book called Enhance Your Presence. And our topic today is how to turn your practice into a selling machine. And we could add a subtitle, The No Stress Way to Add Revenue and Have Your Staff Get Behind It and Your Patients Thank You for Doing It. And we'll get into all of that. Today we're going to talk about how you can easily and quickly grow your practice revenue by getting better at just one skill, and in the process have your staff and your patients be glad that you did. And it starts with the idea of selling something. So I put on the screen here this simple statement, and I'd like you to use the chat box right now to fill in the blank here. When you see the statement, selling is, type in the first thing that comes to your mind, whether it's positive, negative, neutral, whether it's a question. just go ahead and type into the chat box, and that will get us started. Selling is. What is selling for you? Well, obviously there are going to be some negative ideas. For some people, selling is distasteful. Some people think of it as dishonest, manipulative, dominating. Some people feel like it's being like a, quote, used car salesman, or it's okay, but it's something that I'm just not good at. But there's some positive sides to selling too, and we know in the world of business that until somebody sells something, something very bad happens, and that's nothing. Nothing happens in business until someone sells something and someone buys it. So selling really is essential to life. It's a helping act. It's a way to support people and serve people. And in that sense, it can be and is, by the very best practitioners, a very professional pursuit. And we like to say at Changewell Training Academy that it's a natural ability, that no matter how good or bad you think you are at selling, you actually have a natural ability, and that's what we're going to try and get at in the course of this webinar. Now, as a leader of my own businesses, I've had several opportunities to interact with our various sales staffs, and I know that in the course of hiring many sales consultants that all of them have their own definition of what selling is. But ultimately it comes down to this. Selling represents an exchange in value. And in a medical practice, your patient wants a result and they're willing to pay for the chance to achieve it. And our job is to help them get what they want. In other words, we are there to facilitate a win-win value exchange. And we're going to suggest that you use our EMOS model, E-M-O-S, 4 simple questions that will help you approach the selling situation with your patient in a way that serves them and serves you. The first is expectation. What outcome or result does this patient want? Is that realistic for them given who they are, the age they are, their body situation, what's going on with the rest of their health? I know that from time to time I've gone into an aesthetic practice and said, can you give me something to make me look 25 again? And they tell me, that's not realistic for you. But they can help in other ways. Then there's the question of the match. Given what the patient wants, do we have something that we could offer them that could provide that? And again, is it appropriate for this patient? Is it the kind of treatment that would work well for them given who they are? Then there's the question of presenting it to them. Can I frame an offer to provide this product or service in a way that serves this patient's best interests? And if I can, then there's going to be a response from the patient, and frequently that will be some questions and maybe some problems or objections. So what are those problems or objections? What causes them to arise? What's standing in the way between what we offer and what they want? And how can we help this patient remove objections so that they actually get what they want? Frequently, it's a matter of just a little bit more education for them to understand the link between the problem or situation that they have, what the doctor or healthcare practitioner has recommended, and what this product or service provides and how it actually could solve the problem that they have. So again, selling really is the process of helping them get what they want. And in a healthcare practice, we have some extraordinary wins at our back, things that make it easier for us to sell. And the biggest part of this, of course, is the fact that they trust you. People, they would not go to doctors they don't trust. So they trust you. They trust that you're going to understand what their problem is, that you're going to design a solution or treatment care plan that relates to that particular problem, and that you're going to deliver it in the best way possible. So if we're talking about something that's prescribed as part of a treatment plan, you're likely to find, and I'm sure this is your experience, that patients perhaps eagerly will embrace that. No problem if it's presented as, you have this situation, doctor wants you to do this. Then there's the question of recommended. It's not necessary to treat the situation, but it's a good idea. It's something that should be included, and the doctor thinks, yeah, this would actually help you some more. So if it's a doctor recommendation, that's a good thing. Often patients will request something. You know, while I'm here, is there something you can do about this freckle on my nose? Well, if there is something you can do, then that's an opportunity to sell another product or service to that particular patient. And then there are things that are just offered as a way of convenience. So for example, if the doctor says, you know, we've taken off that one lesion, I want you to use this sunscreen, I want you to use it regularly. You might say, by the way, in addition to the sunscreen the doctor wants you to use, this also comes in a lip balm and a tube. Would you like to take that home today? So you could actually offer something that is a companion product for what is recommended or prescribed. Now, we can apply these basic ideas to any part of the practice, including the practice as an entire entity. In other words, before they even walk in the door, we could talk about that. We could also provide these ideas or apply these ideas to services and treatments. And today we're going to focus particularly on sale of products inside the practice. But I want to bring Mark in here. And Mark, I'd like you to walk us through how we can take this basic idea of serving the patient and apply it to the practice as an entire entity.
Thank you, Robert. We do an exercise, a very simple exercise, but it's one that I'd really encourage you to do in your own practice. It's the elevator exercise, and you've heard it before. You are at a conference, you're wearing your name tag. It identifies you as a practitioner, let's say in Wichita, Kansas, and you are a practitioner that's involved in aesthetics or integrative health or any variety of treatments. Another person gets in the elevator and says, oh, gee, you're from Wichita, Kansas, and you have this kind of practice. Tell me, my mom lives there. Why should she come see you? Now you've got 30 seconds. Can you do it? Can you do it in a way that is succinct and clear, in a way that gets across the benefits of what you do? And what's equally important, can everyone in your practice do the exact same thing? Now, this doesn't happen by accident. It requires education, scripting, and practice. But until you have this level of clarity, you'll have unless you have this, you will have a harder time getting yourself noticed, known, and remembered. Now, presence is interesting because patients today have very many choices. And the question I would ask you is that, is your presence in person and online attracting the kinds of patients that you want to treat? First of all, you've got to get clear on who those patients are. But then, as you look at your presence, ask yourself A, B, C, D, because certainly this is what your patients are looking for. Is your online presence authentic? Does it capture the spirit, the why of your practice, the essence? Or do you have a website that looks like everybody else's vanilla aesthetic or integrative medicine website? Is your online presence benefit-centric? So often we see practices that just list feature after feature after feature and don't get to the customer benefit. You know, there's a saying in advertising that one should talk less about one's grass seed and more about the other person's lawn. So that's what we'll talk more about this a little later, the importance of your online presence being benefit-centric and your personal one-on-one presence being benefit-centric as well. Is it culture-based? You don't do this practice alone. You're part of a team. And that team collectively, along with you, have shared values, shared beliefs. You've got a unique environment. So you want to make sure that that comes across as well in your online presence. And finally, are you different? Can you differentiate yourself from the practice that's just down the street from you? Now, we believe that one of the best ways to do this process of getting authenticity and benefits and getting your culture and differentiating yourself is through video. Patients will look at 8, 9 sites before they decide on a practitioner. And they've got 10, 15 seconds to very quickly, just like that, make that decision to delve further. If you have a short, and it does not need to be longer than 90-second video on your homepage, right above the fold, talking about welcoming that patient into your practice, you're much more likely to get them to make that phone call or do the online appointment. This is so important, in fact, that we have a short little blog on this, a video blog, on how to put a human face to your practice, welcome to my practice. You can find it on our blog, changewell.com/blog. Well, let's say you've succeeded. You've got that patient to call your practice. And this young lady is going to answer. Now, chances are the person answering the phone is a millennial. They may well be the lowest paid, least trained person in the practice. And you have entrusted your practice success, and you put it in their hands. You spend all this money for SEO and blogs and advertising, and the phone rings. Now, if you were to ask the receptionist, and there might be some on the call today, what is your job? What are you supposed to do? And they'll usually say, well, my job's to answer the phone. To this, I say, wrong. That's not your job. Your job is to be so compelling, so enticing, so inviting that you literally suck that person through the phone lines and get their butt in a seat in your waiting room. And you do that by, first of all, making sure that it's not a doctor's office. Jenny, can I help you? This is Sarah. Okay, just a moment. Good morning. This is Sarah. Welcome to our practice. How may I help you? Good morning. This is the Integrative and Health Resource Practice. I'm Jenny. How can I help you today? So we want warm and inviting, and we don't want people to get caught up in giving features as so much as affirming the practitioner. I mean, that's their job. Their job should be, you know, Dr. Smith, he's so great at this. You really should come in and see him. You know, he's actually even treated my mom for this, and oh, she looks so great. So her job is to be welcoming and affirming. The consult is the place really where the rubber meets the road. You know, many practices will actually devote a special day or a part of a day where they do their new patient intake. And these the office, they just spiff the office up a little bit. There's more fresh flowers. Everybody's got a great night's sleep. But the consult is really where you're going to bind that patient and begin the process of having them become a patient for life. And if you think about the tools of the consult, there's really three. There's time, and we're so fortunate in cash pay healthcare, be it aesthetics or integrative care, that we have time. We have more than the 8 or 10 minutes of conventional allopathic care in which the practitioner is basically typing on the keyboard and looking at a screen. We have the time to listen to patients and to be empathetic. Now, being empathetic means that you've heard them. You've heard their issue. You've heard their concerns. And you're able to demonstrate that in what you say. You know, there's it's amazing how body language plays such an important role. Being eye to eye with the patient, open body language. And here's one of those occasions where 1 or 2 centimeters can make all the difference in the world. It's sort of like putting in golf. And that is just leaning in slightly as you listen to that patient, letting them know that you're there and you care, and that you have, in fact, the solution to their problem. You know, so often we see practitioners should on their patients. You should, you must, you have to. Rather, the way you build a stronger relationship is through the process of inquiry and asking the questions that deal with motivation. I'm trying to understand the patient's why so that you are then able to tie your treatment plan to the patient's deeper motivations. So those are some of the basics around presenting the practice and talking to patients a little bit about services. But really our focus today is to shift to look at in-office product sales, the sales of cosmeceuticals and nutraceuticals, and how you can make a big difference in that. Now, if we look at practices, and if I take a typical dermatology practice, they do a fair amount, obviously, in treatment, but any place 15, 18% of their revenue may well come from office dispense products. So I'll just use for ease of numbers, if it's $1 million practice, that's $150,000, and $75,000 of that go to profit and to office overhead. In some practices, we'll see that up 25%. There are practices that dispense large volumes of nutraceutical products that may get as much as 40% of their revenue from office dispense products. So it's an important part of overall revenue. But if we're going to talk about revenue, we should really talk about the elephant in the room. What is the elephant in the room? It's money. So it's not a comfortable subject for a lot of people. In fact, there's a lot of discomfort with money. Why? Because everything we think and feel about money has been learned. It's got taboos around it. We just don't talk about politics, religion, sex, or money. We just don't go up to somebody and say, how much money do you make? Of course, my son thinks this might be a good, my son daughter thinks that this could be a good screening test for a potential mate, but I just don't think we're going to do it. These taboos make the money discussion kind of mysterious and bad. And if you think about it, money has different meanings for everyone in your office. This could be a fun lunchtime discussion. Think about, what is your earliest memory of money? What messages, ideas, and attitudes about money were conveyed to you by parents, peers, and others in your community? And then the payoff is, how have these attitudes and messages affected your decisions about the money exchange with patients? Is your perception of money a barrier? Well, let's look at your comfort level. How comfortable are you recommending products and services that you personally, because of your beliefs and feelings and values and experience around money, that you consider it expensive? The antidote to that is to recognize that no one made you judge and jury. It is not up to you to make decisions with your patients' wallets, because you do not know and will never know the value that a product or service can have for that individual patient. So you must remove your perception, your coloring of your own thoughts and values around the meaning of money from this discussion. You never make decisions with your patients' wallets. Now let's look at your comfort level with recommending products, services that somehow you know won't meet the patient expectations. Now, there's two parts to this. The first of which is know thy product, know thy product, know thy product. You need to know how effective a product is. What percent of relief will it provide? What skin types, what individuals will this product work best in? Then you have to honestly and with great integrity strive to make a match. I follow the medical literature a lot on the sales of products and services. And if you look at the AMA, they take a very hard line that's sort of, no one should ever profit or sell or make money from sales of these products inside a practitioner's office. Well, in the cash pay world, we obviously depend on products, and they're an important part of the revenue stream and a valuable service. But for those of you who are hung up ethically, consider this. Consider posting an ethics statement. Now, what is that? It's something that didn't come through. It's something in writing that basically, it didn't happen. It's basically an ethics statement says, one, you are free to buy your products any place you want. Your care will not be compromised or changed in any way if you choose not to buy these products here. You are getting these products here because it is convenient, they are quality, we know it's safe. And then the next point is you might also consider letting them know that a portion of these proceeds go to help staff education, staff training, take care of the staff. And the other point being that you might think about donating a percent of the product sales to charity. This is really a nice hook for individuals as well. Another question that patients will ask, well, wait a minute, can't I get this I buy my skincare, my nutraceuticals at Walmart, CVS, Target, or GNC. So how do you deal with that? Because this frequently does come up. And we know that patients may buy the first product from you right there. Well, they've got the trust and the sense of timeliness. But if we follow professional cosmeceutical sales, only 30% will then buy their first refill from you. 15% will buy the second. Of course, this is where having an online store can be really, really helpful. But what I want you to hold on to, and this may be the most important thing in this entire presentation today, it's from page 87 of our book. And if you can, write this down, these 4 little statements. They should be written down and put in some places where the eye frequently goes, so that you can, in order to, which lets you, and that's important because earlier I mentioned features versus benefits and being benefit-centric. So let's look at what that means. So what are some of the benefits of professionally prescribed, professionally dispensed nutraceuticals? Well, they're the right ingredients and the right dosage. We know that they're pure and safe, and only professionals have access to these products. Or cosmeceuticals, they're professional strength and active ingredients. They're the best for your skin because the practitioner knows about your individual skin type. These have been tested by physicians. They're verified. So today we do have an issue with counterfeit, expired, gray market, illegal, toxic ingredients, and improper storage of products. So if we begin to put this all together in what does our feature and benefit language look like? And Robert, maybe you'll come join me with this as well. So let's take the nutraceutical one. That's a pretty simple one. We offer these nutraceutical products in-house because we know they're safe, we know they're pure, they are the right dosage. We know that when the label says you get a certain amount of an ingredient, that ingredient will be in the product. And that's important because for you to get the results you want, to be as healthy as you want to be, you need these products in the right dosage, in the right agreement, right ingredients for your unique condition.
So let me see if I understand what you're saying here, Mark. If I'm presented with something in an office where the nurse or the doctor says, this contains 1% retinol, is that a feature or is it a benefit? Well, the answer is it's a feature. A feature is anything that's actually in the product. So it's something that's physically part of the product. It's a feature. What's the benefit of it having 1% retinol? Well, that's the highest strength of that particular compound, which confers the benefit without irritating the skin. So that's how you do it. So this has 1% retinol, which is important because your skin condition needs something that's strong. And this is the strongest thing that we can provide for you at this time. And it's provided in a large enough concentration that you'll get the result you want without having any redness or burning. So that's a feature benefit kind of conversation. So, and it's really important, going back to what you said, Mark, for people to know the product and be able to describe what's in the product and what that does for people so that people can understand. And this is where really it's not so much selling as it is educating. If you help the patient understand what they have, what their condition is, what the cure is, and how the product delivers that, then they'll probably say, yeah, sure, sounds like a good idea to me. So we know that in webinars like this, checklists, 5 things to do are important. So today we're going to offer you 5 things to never do when selling. Number 1, never think of selling as a contest between you and the patient. And if you're the doctor or the healthcare practitioner, don't set up bonus plans that put your staff in that situation where they win a bonus as the primary outcome. You actually want the patient to win as well. Never present a product or service by features alone. Connect features to patient benefits. As Mark said, don't make decisions with your patient's wallet. Don't ever think, I know they can't afford this. You actually don't know. Let them tell you. And if they say they can't afford it, explore that a little bit and see if maybe you have a financing plan or something else that can solve that problem. Never assume that you know what they need. Instead, ask them. And 5, never forget that your job is to facilitate a value exchange in which you help them get what they want. That's the best way to proceed in a selling situation. Our business at Changewell Training Academy is founded on this very simple idea. To grow your business, you must first enhance your presence. What we mean by that is we want to see more of you as a person, you as a practitioner, and you as a business out there person to person with the patient. And we say that when you do that, your business will grow. And so that means that you need to stand out in 3 areas: in person, on camera, and online. And that's what our work is designed to do. And perhaps the fastest way to get access to the concepts that Mark and I have developed together is through our book, which is called Enhance Your Presence: The Path to Personal Power, Professional Influence, and Business Results. Kindle and print versions are available now at Amazon.com. We're working on the audio book as well. Now, inside the book, you'll learn skills in the area of presentation. You'll learn how to present your ideas in a way that gets attention, holds attention, and gets your message remembered and acted upon. We'll teach your persuasion skills, how to present your ideas to people in a way that gets them to adopt and follow your ideas as if they thought of them themselves. And we'll also show you some promotional skills, how you can put yourself out there in a way that is ethical, non-manipulative, and yet very effective at attracting to your practice the exact kind of patients that you want to treat. The results of our work, based on the hundreds and hundreds of clients that we worked with, are these. People become more skilled immediately. Those better skills lead them to be more confident, and that means that they're worrying less about how am I doing, which allows them to worry more about the patient. How are you doing? And that causes a growth in a desire to succeed by truly serving the best interest of the patient. And in that kind of an environment, sales happen naturally. There's no need for contrived sales pitches. You don't have to memorize lines or tactics. And out of this, the practice becomes very personal, very present, very service-oriented and enhanced, and that means you have a growing business. We've put these concepts into our corporate sales training program called Sell Well. It's for groups and teams and corporations. And Mark and I were thinking, how can we make these same ideas available to people on this webinar today? And here's what we've come up with. We have a 1-hour course called Principles of Presence, how to get noticed, known, and remembered. And we'd like to offer that to you today. The video course, it's about an hour in length. It's broken up into short segments, about 5 to 8 minutes. You can watch them anytime you want. You can watch the entire course in a little over an hour. It's $69, inexpensive. We have a video course and book bundle, which is $79. And we have a special link, and you should copy this down and enter the link exactly as you see it on the screen, bit.do/ and then in caps, MRNVID. So again, it's bit.do/MRNVID, MRNVID. And if you have trouble with the link, you'll find it on our website, which is changewell.com under offerings. That's available right now. And if you'd like to reach out to us and engage with us on any of the ideas that we presented today, here are our email addresses. And we actually do answer emails, don't we, Mark?
Yeah, we do.
Yeah. So you can reach Mark, mtager@changewell.com. You can reach me, Robert John Hughes, RJ Hughes at changewell.com. And again, the link for our special offer today is bit.do/MRNVID with the MRNV in caps.
Great.
And that's it. Jamie, we'll turn this back to you.
Perfect. Well, thank you so much, Mark and Robert. That's a fantastic presentation. And I just want to make a comment that to all of our attendees who are still on, keep in mind that although, some of the presentation was focused on selling nutraceuticals and skincare, I know from working with you guys that you're selling so much more than that in terms of products and services. But those rules and recommendations around selling are still completely applicable to all types of things that you're selling in your office, and great rules to practice. And the 5 things never to do when selling, if anybody wants to see that again or wants a copy of this presentation, don't hesitate to contact me directly. Most of you have my information, or certainly Dr. Tager or Robert. So thank you again to our esteemed presenters. I appreciate you guys taking time to be here. And of course, to all of our attendees, thank you again, and I hope to see you at our next Med Results Network educational webinar presentation. Thank you and have a great rest of your day.